Hey guys, how's it going? Good to see you. I'm just gonna get all set up here. Hey Eric and Lisa, how are you this week? Hope you're doing well. A warm evening. Hello. Oh, that sounds so lovely. It's a freezing morning here. I've got my heater like literally next to my chair right here. So I'm glad it's warm where you are. Dr. Bart, hello.
Hello there, dear. Good to see you tonight.
See you. Eric and Lisa were saying it's warm where they are. I was jealous.
Yes, we are. We hit it today. Like, and it's not just warm, but it's humid. Like, you walk. Like,
Oh, really?
Yeah. Outside and inside, literally, like it's at least, yeah. I don't really like air conditioning, and yet I can't keep the doors and windows open at this point of the this year. So this is different. I wear like a tank top or a t-shirt outside, and I walk in and I grab my sweatshirt.
Yeah, I know. I don't love the air conditioning either. There is though like 4 or 5 days a year here that I use it. Like it's you need it. It's too hot. Yeah. So today we're going to talk about pain.
Yes, we are. In fact, when we get ready to roll, I'm going to explain why we're talking about pain too. There's a very specific reason. That's something that came up in clinic last week that made me think that we got to talk about pain. And with pain, not just like, yes, we're going to talk about like, but how prevalent is everything around us, our emotional pain, our traumas, our tribe, like how important is all of it when it comes to literally, I don't care if it's sprained ankle, you injured your back, you got diverticulitis, how important is all of those factors? And so this topic this week was motivated by something I experienced again last week, and I want to share it with everyone because I really think this is something that over the years, I've had a lot of pain in my life in a lot of directions, quite frankly. And doing it the wrong way has helped me manage doing things in a better way. And it's made a big difference in my life. And also know with like a lot of the people that I work with over these last 24 years, like the approach that we have toward pain is monumental. Take the wrong approach and we can really end up down a rabbit hole.
Yeah, no, for sure. All right. Well, looking forward to diving in. Let's get started, shall we?
Yeah, let's do it.
All right. Welcome back, everyone, to another episode of the Health Made Simple show. I'm here with Dr. Bart Precourt, who is a healthcare practitioner with over 20 years experience practicing a range of modalities, including chiropractic, kinesiology, acupuncture, functional nutrition, and supplementation, as well as lab testing, all out of his clinic, Balance Health Studio in Seagrove Beach, Florida. Excuse me. And virtually across the world with people on Zoom just like this. He's also the founder of the Health Edge program, which is a cutting edge health program for entrepreneurs and executives wanting to take their health to the next level. He works with celebrities and athletes all over the world. And tonight is going to talk to us about pain and really dive deep into that topic.
Yeah, we're going to dive deep, probably deeper than people think. This broad top, like this kind of generic topic. Absolutely. I'll give you the best herbs, but it's going to be a small version of what we're talking about tonight, Karen. And I'll talk about the, diet wise. And of course we'll touch on those, but that's going to be a smaller version of what we do. Yeah. Tonight, I want to kind of go a little bit deeper into the whole idea of pain. Our entire healthcare system works off yours, mine, everywhere around the world, really works around the one premise of reducing and avoiding pain altogether. So before I dive into anything, first of all, let me just welcome everyone. Welcome if you guys here on Zoom. Awesome. Love having you every week. I get a chance. I see your names up in your corner. So love seeing you guys here, and love to keep having your input as we go here. If you got questions, literally just put them into the chat spot here on Zoom. Awesome. If you are on Facebook watching us live, awesome. High five to you guys. Thank you for being here as well. And same thing, you guys can put your questions, and especially tonight about pain, if you guys have questions about it, and especially as we do a deeper dive, if you have questions or comments or want to share something, I'd love to have you do that. So welcome aboard, everyone. So let me back up a couple of days. I'm going to back up to last Wednesday. And if the peeps who, I'm not going to use any names, but I'm going to be real specific about this. There was an episode that took place where I got an emergency call, and someone basically said, they need Dr. Bart right here, right now, if there was any. And it just happened to be, Karen, that my schedule was free, and I was headed to a cafe, which I was going to Prima, and which is right now, or 10 feet away from my clinic. And I said, all right, yeah, let's do it. I'll help him out. So I get up there, and there's a guy there, and he's probably just a little younger than me. I think he was 46, 47 years old, something like that. And he's stuck in his SUV. He's in the passenger seat, and like, he can't get out. And my staff and my wife had already kind of give me the lowdown the best that they could. And then he had like a little bit of a bike wreck, and he got up, was able to walk away, no big deal. And the next day is when all this pain happened. He literally couldn't move. And it was kind of an oddball pain. It was right in the middle of his spine. So it wasn't really, clinically a classic sign of like low back because he fell on it, or a tailbone fracture or anything like that. So I say, sure, I bring him in, and, we come in, and I could tell right away that something was a little bit off in this, you kind of get a sense. And like, because when I say the guy couldn't move, like he would take a 6-inch step and like hold in like the ability to scream, and I'm scratching my head a little bit. Maybe I should be sending him someplace else, but
Does he need to go to the hospital? Has he broken it?
And we certainly, prior to that was an option. My staff gave him an option saying, listen, you can't even get out of the car. You need to go to the ER and whatever to get you through this bridges moment. They were insistent though that they wanted to see a chiropractor. They're very familiar with chiropractic, and certain that's where they needed to be. So it was a husband and wife. So eventually he comes on in, and so, that's my job to kind of assess the whole situation physically, mentally, spiritually. And I know that sounds odd, yet pain is never what it appears to be. Meaning how bad something is never what it appears to be, because there's always so much more around the situation. Even if we're talking about like a wound or a cut or something like that. Truth is, cuts heal, Karen. So no matter how bad it is, how bad someone's banged up, the body heals. So that, we have to, that's our job as practitioners, to take that in consideration so we don't get sucked into, the scary emotion of it all. So anyways, I get the guy in, can't lie on my table. So literally that's like the situation. He couldn't even lie down or anything like that. So I'm getting as much feedback from him as I can. And we have a very difficult time when someone's in fight or flight to help them heal. So we have to, the best we can as practitioners, help them shift. And just going to give you insight as a practitioner, before I can really start to manually treat somebody, I got to do the best that I can to get them from that fight or flight state, that really, really scared state, no matter how much pain they're in, to shift that pendulum a little bit into a parasympathetic state. Otherwise, any input, good or bad, can just provoke even more sympathetic dominance, which is fight or flight. So I was doing this. We were having good conversation. I was getting his breathing regulated a little bit, none of which he knows I'm doing, but this is the situation that's happening. And then in comes the wife. And immediately I recognize, whoa, something is off here. The wife comes in and says, do you think you're going to be able to fix him up? He needs to take our son to his all-star baseball game tomorrow morning, and it's a 10-hour drive. Immediately, this guy's body cringed right back up. Neither one of them caught it, but I did because I had my hands on him. So I was like, oh man, just 8 minutes of work right there of just calming him down. I got to start over again. So same thing. I get, ask some simple questions. I get a couple agreements, and agreements help the body get present. So, and I'm sharing that because that's one of the things I want to share tonight is if you ever encounter somebody that is massively hysterically in pain. Let's go as far as they've been shot, they get hit by a car, they've been run over by a bike, they got bit by a dog. We got to get them out of that fight or flight state in order to help them heal. And that means we got to shift where they are. We got to get them present. Instead of the fear of what's wrong with them, they've got to get present. So one of the ways that we do this is by getting them to have acknowledgments. And we could do that really good. Okay, can you just breathe a little bit for me? They do a little breathing, you acknowledge, good job. And now we're present. And we do a sequence of that before we start the actual treatments, or maybe you're just helping someone until the ER gets there or the ambulance gets there. And those subtle little things often can be life-changing if we can keep them in that moment. So I'm doing this, and this is just a normal everyday thing that, you know, I do as a practitioner. Actually, it ties into my old school hypnosis background, but nonetheless. So I'm doing this. And then again, she speaks and says, I'm doing some work on him and, you know, like getting things to unwind. And she says, do you think he's going to be able to go to the beach later?
Oh.
And I say, no. When we're done here, I'm sending you home to ICE, and you're going to have a beautiful vacation, just lie in the living room floor, watch some TV, watch some movies. And this is built-in timeout for you. And she's like, oh, this is her. Oh, good. Now we can't even do that. And then again, he winds right back up. So we took this problem that was there, but because of his tribe, the pressure on the healing, he kept going back. And literally, she would speak, he'd bind up, and he'd start making noises. Oh. And neither one saw it. And then eventually I adjusted him. He was like immediately like 30, 40% better, enough to get him to swing the pendulum was a little bit better. Immediately she chimes in and says, do you think he's going to be better to bring his kid? My son has to be able to go to this baseball game. He's been waiting for this all year long, and we can't not do it. And immediately, right back to where he started. Right back. He was literally on his way out to the truck, walking relatively normal. She says it, and boom, bound up. And I share that story to know that how we act and the fear we give somebody or the pressure we put on somebody to heal is massive. So I'm going to go through some things tonight about, there's really 3 different types of people when it comes to healing and how we approach pain. And then in this, I want to weave what our tribe does or does not do it. And listen, all my moms listening out there, listen, I love you. You're awesome. You love your children, but often you are the worst when it comes to helping your children. You do it out of love, but you do it out of a fearful love. And so I want to help us just kind of navigate those words. So, and as I say what I'm going to say tonight, no matter where you are, know that I'm never judging you. I'm never like picking on you or calling one area better than another. But pain is something that's very, very natural for humans to have. In fact, it's what gives us our experiences. The fact that we can put our finger close to a fire, have a little pain, keeps us safe.
Yeah.
Those subtleties are so incredibly important. We go outside, it's a little cold, so we can back off and create some warmth or whatever it may be. Those natural facilities that we have, if we inhibit those facilities, we are inhibiting human vitality. We're inhibiting human health. Inevitably, someone says, well, Bart, there's no way that pain's good for you. So just hold on if that's your thought, because I'm going to walk you through some different things here. And we'll talk about the 3 different mechanisms, because a lot of people, quite frankly, they give up function in life just so they can give up pain.
Yeah, which is crazy, right? Which is interesting. And I think what you said, even when you're saying you're not, as you go through, there's no judgment. A lot of the time we're not aware of any of these things, like until maybe, hopefully you're creating some awareness in this episode this week, because even in your story, the wife, she was in her own pain potentially, it's just a different type of pain. And she also didn't really, as much as she would know that she's putting pressure on another person, she doesn't really notice that that's affecting him like that, or really she's caught up in potentially her own pain with whatever pressure she feels, and she hasn't thought about his pain or what, like they're both kind of reacting to their own pain without any awareness of what we're kind of talking about today.
Yeah, 100%. And that's exactly why I want to do this, because everything we do does impact and does influence other people. And we can either support or we can become a hindrance to that journey that each one of us is on. And, in that moment, like I love that you just said that, because in that moment, man, I was mad. I was like, I was mad. Like I wanted to headbutt her. It would have been inappropriate.
Yeah, headbutting's usually frowned upon.
Mostly frowned upon in the doctor's office. Yeah, I was like, come on, this is your husband. Like he's doing the best that he can. Like, and it just reminded me that sometimes, just like you said, we don't know that we are inflicting pain. And this was emotional distress that was taking his fundamental, it was basically what we call a rib head out. And don't get me wrong, they're painful. You feel like someone's stabbing you with an ice pick. but manageable. There was no fractures, there's no disc issues, there's none of that. It was this fundamental thing, taking this thing from what should have been a 5, 6, 7 pain into a 9, 10 full blown, this is a problem. But you're right. Like sometimes we don't. And that's why I want us all to have awareness, and don't hate me for the things I'm going to create awareness about. And it's just been an interesting ride. I've been practicing for 24 years. And as a chiropractor, I work with people that are in pain, and in the beginning, I thought it was just all musculoskeletal. And then I was like, well, that's interesting. They were dying yesterday. And then they found out that their boyfriend really does love them and they're fine today.
Yes, there's an emotional component to all of it, right? And we're going to talk about emotional pain and physical pain tonight, right? Because they're both pain.
Yes. Yeah.
Yeah.
And then we'll even talk about what does it mean when you have all left-sided and right-sided pain? We'll dive into as many different directions we want to go. But let me kind of bring up the kind of the three categories, or three groups.
The three pain personalities.
The three pain personalities. And really, this is just Dr. Bart's list. This is not in a book, or there's no research papers on this. This is just my clinical observation over the years, and even my own journey for that matter. So the first pain personality, we'll just call them type 1. The type 1 is really the best pain is no pain. That's their life, right? And that comes through a multitude of different reasonings that they have. That one, all you have to do is watch TV. Your entire life you've been told to avoid pain. Everything from literally your mom saying, be careful, you're going to get hurt, don't climb that tree, to who knows, don't roughhouse with the dog, he might bite you. You know, like all of these things to avoid pain. And then if you have pain and you're watching TV, you know how to get rid of GI pain. You just take this medication. How to get rid of headache pain, how to get rid of emotional pain, anxiety pain. Like you just have to watch for a couple hours and you're borderline an expert, because you'll have a multitude of different medications and drugs that literally will make your pain go away overnight. So that's number one category. That individual, their life is just no pain is the best pain of all. And there's really not a link between the mind-body connection, and there's no desire. If they have pain, they don't want to know the alternative route. They don't want to learn about breathing and meditation. Listen, I got pain. What do you have to make it go away the fastest as can be? And what's really interesting, Karen, in this category, they will compromise human function for pain reduction.
Yeah.
And this is real, folks. So listen close when I say this. You would think there's no way that anybody would give up how a human functions, like give up function just to get out of pain for an hour or 10 hours. Well, we do it all the time. I give you an example just when we were talking here earlier. Gallbladder pain. So listen, you got a gallstone, gallbladder gets blocked up, hurts like a mofo. It is not going to kill you. No one dies of gallbladder pain. Nope, not going to happen. But it hurts, man. It hurts bad. You go to your doctor and say, what's wrong? Your gallbladder sludgy, it's backed up. Take it out. You now no longer have a functioning gallbladder.
Yeah.
So to reduce your pain, you gave up a gallbladder. So no big deal. It happens like the 4th leading cause of surgery in our country, happens nonstop. And people think no big deal. But now you can't metabolize fats as well. You can't get fatty acids to your brain. You can't get fatty acids to your skin. You're more prone to things like psoriasis and all the different type of skin issues and hives and all react to your body. So you're giving up human function. No doubt about it. Your stools change because you can't absorb fat. So it's legit. You become more carbohydrate orientated. Your pancreas works over time because you don't have the right enzymes. It's legit when you give up your gallbladder for pain. And that's what happens. And it's not your fault. So inevitably, there's probably, I don't know how many people watch tonight, but there's probably at least 20% of people watching, maybe 10% of people watching, gallbladders are gone.
And so common. Yeah.
Get rid of pain, they gave up their gallbladder. But we do that all over our body. We cut things off, we cut them out, we replace them nonstop to reduce our dealing with pain. And I get it. I get it, but I also get what happens when we get to listen to our body as well. So that's type 1. Listen, no pain is the best pain whatsoever. And there's no judgment here. It is just over the years, I see it. When they come into my office, there's not a real good fit, because when I adjust them, they go, doc, it still hurts. Like I said, well, it's not a magic wand. Like, this is a healing process. Well, doc, it still hurts when I do this. Where take a strong enough drug, it just goes away. Or you do an injection or something like that. So you don't see a lot of that in the alternative healing field because they're just a different mindset. So
But this is what doctors tell you. Like, if you have had your gallbladder removed, you probably thought that that was the best option for you, because a lot of traditional medical doctors are working on getting rid of your pain right away. You come in, you've got an issue, they get rid of it with the tools they have, and that's surgery and drugs.
Yeah, and make no mistake, our entire healthcare system is essentially predicated upon reducing pain fast. That's how a hospital in our country is actually graded. Like, how fast does a patient feel better? Not what they gave up, not the reduction of function. So another simple way, Karen, is like, and so people are like, well, I wouldn't get my gallbladder cut. I wouldn't cut my shoulder off. I wouldn't, cut a piece of my ear off to reduce my cancer, whatever, right? But we do it in other ways. People may have a stomach issue and then they have pain, right? They have shoulder pain, neck pain, headache, and they keep taking Advil, aspirin, Tylenols until it causes a gut issue. And they know it. Man, I got to take this leave, but it causes me a gut issue. Decreased function of the gut. I think everybody knows that antibiotics damage the gut, and I know they can do some good, but you lose function of the gut, and they'll do it over and over and over again. So that's kind of the number ones. Most likely here tonight, we may have some ones, but mostly ones that are already turning into twos, or twos turning into threes, or all threes, because you're watching something like this and you're doing a deeper dive. And you have to do a deeper dive because you started on a different part of the diving board. Like, you started in a spot where like you're all in and just pain reduction, and you have to kind of get in a different mindset. You got to find yourself on a different path. And that's how you end up on a show like this tonight. Anyways, all right. So let's go to number two. Number twos, these, we'll call them pain peeps. They have the knowledge. Okay. They know that they don't want to mask their pain. They understand that fundamentally, that if they have shoulder pain and they're always using a medication to mask it, like, it's probably not a good idea. That they're throwing a tennis ball, they're throwing a baseball, and they take a leave and it doesn't hurt, and all of a sudden they keep throwing it. They, in the back of their mind, they know it's probably not a good idea that I'm always masking my pain. And that could be anything, any drug or medication that they're using it. They know that information, and they've started their journey. These people, it's interesting now, usually are talking about that they have a good pain tolerance. And I want to talk about pain tolerance a little bit tonight too, because it's real interesting what it means to actually be able to tolerate pain. So they talk about having this good pain tolerance. Yeah, I can handle pain. I'll just push through it, all that kind of stuff. And this is usually true for these people up until the moment they have a lot of pain. And then in that moment, they often will throw the towel in them. And these are the famous words. So everyone listening tonight, and again, do not get mad at me for this, but these are I've been practicing for 24 years. I love you all, and I've listened to it all. And these are classic words right here that happened for the type twos. This is what they say. They say, but I had to. I had to fill in the blank. Take the aspirin, take the antibiotic, get the surgery. I did everything I could. And really what they said, their pain tolerance wasn't full. It was limited. They had a certain pain tolerance, and then they got to their point. That pain could have been emotional, physical, spiritual. And these are real things, Karen. So let's just say, for example, we're talking about what if you got some kind of pain, and when you take the medication, you can play baseball, and when you don't take the medication, you can't.
Yeah.
Your tolerance might be, listen, I just want to play baseball.
Yeah.
But then down the road, you know that all of a sudden taking an anti-inflammatory inhibits your ability to absorb things like zinc. Now you're a little bit more vulnerable to prostate cancer, or you can't absorb calcium. You're going to make weaker bones. So you technically are reducing function, but it's much slower.
Yeah.
And it's a slow pain relative to the other pains. Yeah. So the type twos will say, I just had to, and they'll take the antibiotic knowing that it was going to rip up their gut. They'll take, a bunch of leave to decrease the pain. So the number two, what I see with the number twos is this. It depends on how long they've been in that category.
Okay.
If you're on that journey for a long period of time, they kind of toy with pain tolerance. They'll see if they can work through it sometimes. They'll be like, all right, see what I can do. But they still haven't created one of the most important things when it comes to pain tolerance, and that's patience.
Oh, definitely. I mean, well, I think I think we all at some stages, or a lot of us, in me included, struggle at some points with patience, because it's if we do get a headache, like, we have to stop and slow down, and sometimes we don't want to, just like the baseball player, but it might be driving your son to somewhere, or going to work, or something else, and I think patience, definitely falls away sometimes.
But I want to throw something in there that can make that patience game a lot better.
Mm-hmm.
If there's not blame, then it changes the whole game. So let me explain this. When they say to me, and they say, I just had to, and really what they're had to is, it was so bad. It was bad. It was ugly. It was mean. It was yelling at me, whatever it may be. If the blame goes to the outside, we're in trouble, because you're not going to take the actions to correct what took place here. You're going to mask it up and say, wasn't my fault, nothing I can do about it. I'm going to take that pain medication, really because I'm impatient, but I'm going to act as if I did everything I could, and I'm just going to keep moving forward because that's my pain tolerance.
Yeah.
So a little bit here, right? But that's how it goes. There's a flip side to that. In the event we have that injury, we got the headache, we have something that's inhibiting us from maybe doing something that's very important for our lives, and we would put it on the scale, being like, hey, listen, I know this is going to bum me, do something. But in that lack of patience, or that decision making, that we say, I'm moving forward here anyways, in that moment, that we also say, my own fault.
Yeah.
I pushed it. I didn't get enough sleep. I ate like crap. I've been eating gluten for a week. I should not have run 10 miles. My knees were killing me the whole time. All of this super real. When we take it on, learn from it.
Yeah.
The biggest travesties that I see in pain management is that people don't learn. And we can't learn if we think that it's bad.
Yeah.
Follow me?
Yeah.
So
Yeah.
And that's one of the biggest things. When we get to the number threes, we'll talk a little bit about what they do that's very, very unique. So another thing that's very characteristic about the number twos is this, that number twos have this unique way of really creating an interesting story about their pain and about their mishap, about their surgeries, about you name it, but they kind of wear it as part of their personality. And like, hey, what's going on? Oh yeah, I just had a shoulder surgery, blah, 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 and here's what happened, and blah, blah, blah. And they wear it out there. And then it'll be, for some people, it has to be very visual. It might be a bandage, right? Like wrapped around their head, or a big Band-Aid, or a pair of crutches. They're all these little things that say, hey, listen, something's going on with me. And listen, everyone is listening to me now. If you've done this, I'm not judging you, but I want you just to have this awareness, because you'll understand when I talk about how number three goes about this, it's entirely different for a very specific reason. So I'm just going to use crutches, because crutches is like crutches, like you're using a crutch. Let's say you got a hurt ankle, a knee, whatever, a foot, plantar fasciitis, a knee surgery, something like that. And one of the options is that you put a boot on and wear a knee brace and wear crutches. And then you go cruising around town. So Karen, if I haven't seen you in 3 months and I see you over at Prima Cafe, you're going to get yourself a nice organic latte, right? You're rolling in there and you got crutches. What do you think I say to you?
What happened? What happened to you? Yeah.
God, Karen, are you okay? Energy.
Yeah.
And then how do you respond to that? You don't respond like, no big deal, I got this. Let's not even talk about it. How you been? That doesn't happen.
Oh my God, I fell off my bike. It was so painful.
We repeat and we continue to use the energy that brought us the pain in the first place, and we keep it alive. if everyone just closed their computers now and just took that away with you, when you repeat the story of how it happened and what had happened and it was an outside in thing, you're keeping it alive. I've watched this happen for decades for people until eventually people let go of their story. And when that happens, man, it's beautiful because you are not your past. You are not your story. And that past might be 15 minutes ago, or it might be 15 years.
Yeah.
But
It
when
becomes part of their identity, really, to have that pain or to have that condition or to have that, it really, yeah.
So what happens here, the significant difference. So the number 3 is we'll shift in there. And then of course, if you guys have any questions or comments, send them at me. Because sometimes when I have these conversations, and I've talked about this on different platforms before, sometimes I get a little feedback, a little drawback. Like, no, I had to, because we get a little angry with it. And I'm okay with that, because when we talk through that, pain has so much to do with our emotional state, the energy we're putting into something, that it plays huge dividends down the road. I was talking with my staff today, Karen. I said, listen, everyone that comes in, like we have a new hire. One of the things I was telling them, I said, listen, don't judge a person on their first day.
Yeah.
Reason being, because oftentimes their personality changes when someone's uncomfortable. And the personality change happens when we have fear, worry, or concern, uncertainty of what's happening. We might have the fear deep down inside. What if this never gets better? What if I'm this miserable all the time? What if I lose this much sleep every night? What if I never get to run again? What if I can't pick up my children? That fear, worry, and concern is worse than the injury. Always.
And sometimes fear creates that. Like when we were talking about one of the times that I do take medication, and I think also saying I had to, like, even you always kind of choose to. There might be a, if you're, unconscious in hospital and you've been in a big car accident and somebody gives you something, maybe that's a had to. But my headache or my migraines is definitely, I've chosen to take some painkillers. But in that moment, I get scared that, the pain like overtakes your rational thinking. And I think that I'm going to, get people to check on me. I think I'm like not going to wake up, which is crazy. Right. But yeah.
So many things that go through our mind, our made up minds.
Yeah.
He's like stinking.
I'm definitely going to wake up. This has happened before. You're going to be okay.
Yeah. And we go to places. I do the same. Like, I can't tell you how many times I've injured myself. 2 weeks ago, I was training, and I didn't tell my training partners this, meaning that I was sparring. I couldn't throw a punch with my right arm. Like I still trained. Maybe I shouldn't have, but I couldn't throw my shoulder was so much pain that day. I literally couldn't extend it forward. So, and there was no way. And I want to share this moving.
And would you have told somebody in your clinic to go to sparring training that night with that shoulder?
No, but here's why I want it, because I know I'm looking at some of the names of people here. Listen, I know that you're going to push through things, and it's okay when we approach it properly. All right. So
number 3
is basically their approach is that they are going to use their pain as fuel. That's ultimately what they do. And I'm going to give you different emotional ones. Okay. So, I think I've shared here briefly that a couple of years ago, my younger brother died. And when he died, it was, man, I don't know if I used my voice enough in the situation. So I still carry a little bit of I don't know if it's almost like a little bit of guilt or shame, or like I should have been a little bit, I should have spoken up more or whatever. I don't know. It is what it is. It turned out the way it is, but there was a series of things that happened in 9 days and he died, and he was 32-year-old healthy guy. And it was just some poor medical decisions that happened rapidly. And I stood back a little bit. I didn't have, I guess technically I didn't have too much I could have done, but that pain sits with me. And it sits me on a regular basis. Now I can blame, and I did for a little while. The story was always, this went wrong, bad doctors, bad hospital, this person pulled the wrong plug, this one did this wrong, and all of that. And then I flipped it finally to say that, you know what, I won't be underspoken again. And that's when I launched all this. This is when I went Facebook Live every day. We have our podcast. And when someone says to me, oh, you're just a crazy, oh, you're, like you're I don't know, like an anti-vaxxer, or you're just a health nut, you're a conspiracy theorist. I said, I don't give a shit what you say. Pain is much bigger than your little uncertainty or uncomfortableness. I know what the message is. I know what it is. And because of that situation, my pain is now my fuel. And there's nothing that will stop me because that pain, I'm using it. And there's a difference there when we get to use it and we let go of that story. So I don't tell the story, the details of what happened in the hospital with my brother anymore. I used to. And I was doing the blame thing. And now I just say, listen, people wonder where my fuel comes from. That's one of the things. That's a little bit where my fuel comes from. I had fuel that just added to it, but that was, most of my fuel has always come out of being motivated and wanting to give, love, and serve. That came from pure pain. So there are ways that we can embrace these things that happen, but we got to let go of the story and end up using it as fuel. So let's talk about the number 3 a little bit more, because the number 3 uses pain for fuel. They use their mistakes as opportunities to improve moving forward. So I love my knuckleheads. I love the ones who are being like, yeah, I shouldn't have done that. And that, it's like, they're limping in and bumping in, like, or whatever it may be. And they're like, yeah, I did it again. I'm like, yeah, it's okay. I'll never tell you to stop doing that and going for that very thing that you love, even if it takes a little risk. The number 2s, Karen, if I go back there for a second, just in general, just their general personality, they often don't like to take big risks because they might fail and be very painful. So sometimes it goes in our personalities. They don't want to ask the guy out. They don't want to ask the girl out because what if they say no? The number 3 doesn't give a crap. They're like, this is what I want, no matter what the opportunity.
It does give a crap, but does it anyway.
Does it anyways. No risk, no goodies. And recognize, but not to give up. So I'll never say risk your physical function. Like don't gamble. I think that's the word I should use. Don't gamble. Calculated strategies. So the other night when I went to train, I didn't go in training thinking, well, I'm going to share with these guys, the guy who's going to try to beat me up, that I can't throw my right arm, my right hand.
Yeah.
To have a different strategy. So I didn't do it and make it worse. I just acted as if it was normal and went through it. That number 3 guy. So I want to change the story a little bit. Now, Karen, you have that sprained ankle. You went running, you fell down. One scenario, you show up with crutches and a boot. The next one, you see me coming and all you're doing is walking slow. That's it. We walking slow and I said, Karen, how you doing? I give you a hug. How you been? What are you doing? Hey, you still running? Yeah, I'm taking a little break right now. I tweaked my ankle a little bit, it's healing up, and I'll be back at it shortly. Different.
Yeah.
Totally different. Same level of pain, different approach. The number 3 recognizes that attracting negative energy to their pain makes their pain worse. It prolongs it. So they intentionally avoid the public attention. This is key. They intentionally avoid the public attention that comes with pain, drama, trauma, loss, all of those things. And it's not because people are mishearted. Like, it's actually just the opposite, because they love so much, but they've been taught on how to add to it and truly feel like, oh my God, Karen, I can't believe it. I know how much you love to run. That must absolutely suck that you can't run anymore. Oh my God, wait while you're doing that. And these are what's
Yeah.
So that energy of it is so important for the number 3s, that they've recognized it because they've been through so many things in their life, and they're starting to learn to try to use their pain for fuel. So now the next time they go jogging, they're not going to use their headset because of that, or they're not going to look at their phone. They learn from it. They use that pain for fuel.
Yeah. And we also were talking about number 3s, when they do, let's say it's especially with things like the headache or the shoulder pain, they ask, like, what does my body need? Or like, what is my body trying to tell me?
Yeah. Ultimately, the big difference in the internal communication, number 1, say this, you shouldn't be here. Pain is bad. Get rid of pain at all costs, even if it helps me function. They don't have that dialogue, but that's really what it means. Number 2s, they're saying, I got good pain tolerance. But it really comes up to, how much they've practiced in life of
Yeah.
being tolerable of having less fortune, meaning I can't run this week.
Yeah.
I'm not telling. So you guys, I want you to hear this right. So I don't want to misconstrue the story. I didn't throw the right punch that night because it would have hurt my shoulder. So I had to change my strategy. And that night I became really good at defense instead of offense.
Okay.
It worked. It was boring, but at least I got to do it.
Yeah.
And that's part of it. That was the gift. So listen, all right, that was my option. I could stay home. I could have medicated up, but at this point in my life, like I'm too much of a knucklehead. I would be medicating myself every other week, like, because I do stupid stuff every other week. I'd be nonstop medicated. So I have to get a little better strategies. So I'm not telling anyone to just go grind it out, because what this significant little question right here, this one, if we just get this is where it all changes. And the question is this: what is my body asking me for?
Yeah.
There's a philosophy that goes with this, and kind of an understanding between yourself and your higher power. And one is that the body never lies, and that the power that made the body is the power that heals the body. Mm-hmm. And if you can just kind of grasp onto those two little things, that the body never lies and the power that made the body heals the body. Mm-hmm. And if you own those on some level, it gives you this great certainty, this great assurance that whatever it is that you're going through, you will get through this. One of my team members today, we were having this conversation at the end of our shift, and she asked me, Emma, I don't know if you're on, but if you are, hello, dear. She asked me a phenomenal question. She says, so how do you give someone empathy when they are suffering, when they have pain? And I said, the number one way to do this is you give them certainty. So you can't be like, you're going to be okay. You're going to be okay. They may or may not believe that in their brain. But remind them that this too will pass, or give them certainty. And when, I don't care who you are, but when someone tells you, Karen, you got this, there's something that wakes up. Everyone listening to this right now.
So true. It really is. Yeah.
And I said, so everyone listens to this right now. I want you to hear these words, and whatever problem or challenge you're facing right now, hear me when I say this. You got this.
Yeah.
And if you just heard that, you go, you know what? You're damn right. Like, there's something that wakes up. There's a fire that wakes up, that we got to wake up again. We got to, like, as humans, we got to wake that beast up and know that no matter what this challenge is, whatever this obstacle is that we got to overcome, we got this.
Yeah.
And the moment we do that, we shift that pendulum from that fight or flight to, I got this.
Yeah.
Be bleeding, and you still might hurt to raise your arm, but you somehow, and if you're the person supporting that individual and you said, hey, listen, you got this. This is going to pass. Let's just breathe through this. And then you just start to navigate those roads. But you too, if you're going to give those words, you got to act like, like a doctor, and you got to be like, calm in the storm. You can't be like, oh my God, you're bleeding from everywhere. Like, that's not going to be helpful.
No, it's amazing how much if somebody is in that situation, they'll feed off your energy, like if you look freaked out, that injured person is going to get more freaked out. If you can stay calm and be like, you got this, it's going to make them feel more confident that they are going to be okay. For sure. You see that all the time.
So let's also navigate the difference between like an acute injury and chronic. Okay.
Yeah.
And we've talked about this a little bit in the show again, but I want to be real in this window here of us creating our tolerance. So, and real quickly on tolerance, Karen, make sure I don't lose that thought. So I got to go back to that in just a moment.
Yeah.
Tolerance is created by certainty. So when someone tells me, the number twos are really good at telling me I've got really high pain tolerance. There's a difference between a tolerance and a pain threshold.
Okay.
A big difference. If I say you've got a really good pain threshold, like, can you take a punch in the face really good? That's a pain threshold. Yeah.
I don't want to take a punch in the face at all.
So most of us do not have a good pain threshold. So what we're talking about is, do we have the tools in place to be able to tolerate our pain? And what that means, we have to have strategies. We have to have a philosophy that we go back to. And that philosophy, hopefully, I pray that everyone shares a little bit of this in saying that body never lies, power that made the body heals the body.
Yeah.
You can always go back to that. It makes you more tolerable for the situation, knowing, you know what, this too will pass and I will get back to running. You know what, I've been down this road before. It was awful. It's going to take me 2 months to recover. Damn, I'm not going to do this again. And you do it. And that helps create our pain tolerance. And I'm not going to give up function. I'm not going to give up my gallbladder. I'm not going to give up, my shoulder or my fingers or anything like that. So I'm going to kind of tolerate that because of my philosophy and the techniques and the tools that we put into place here.
Yeah.
Right.
We've actually got a comment. Well, we will acute versus chronic. We still need to talk about that. We've got a comment here from Eric and Lisa that, so I'm not sure which one of you is talking about this, but when I had lower back pain problems, I had to just accept a certain amount of pain tolerance. However, since last fall's challenge, so the 30-day challenge that we ran, and daily morning exercises, my pain has actually gone away.
Beautiful. Absolutely beautiful, Eric. And that was Eric. And
yeah.
Eric, you basically just teed me up here to talk about what I want to talk about next. So let's talk about some strategies when it comes to either acute or acute pain and chronic. I will tell you, in the acute phase, the most important thing will be your mindset. Most important, better than a drug, better than medication, better than the herbs I'm going to mention to you in that initial acute phase. Your acute phase is going to determine your actions, and it might save you your gallbladder or whatever. And I go back to that just because it's easy to say that. But that might determine what's going to take place next. And it's very, very important. So if you can get to that place, this too will pass. The body self-healing mechanism, the power that made the body heals the body, and then the body never lies. If you can get into that and then create some tolerance for your pain, you got awesome options after that. But I will tell you, for chronic pain, chronic low back pain, chronic shoulder pain, chronic headaches, you name it, the number one thing, Karen, the number one thing for pain management is diet.
Oh, I've experienced this myself with back pain, and I thought that I had some awareness around these things cause pain, but didn't have enough until I actually went and changed my diet. And it's amazing how much it has an impact on your pain. I don't know whether I got it until I experienced it.
Yeah. And you're 100% right. And that's the same thing with me. Like over the years of trying to knucklehead through my pain and then recognizing the impact of having a low sugar, low carbohydrate diet, of incorporating some intermittent fasting, on how much on a daily basis it decreased pain, because listen, that pain, if you're waking up every morning with pain, you start to think, is this arthritis? Even though I don't really believe in it, is this like arthritis or is this rheumatoid? Do I have fibromyalgia? You start to go places. Like, is there something wrong with my body? Do I have some neurological deficit or something? Because you can't understand why you're in pain all the time. But then you make some changes, you clean your body up. And so for those who don't know already, you probably already got an email, but we're going to do our cleanse. We're going to do a quick 10-day clean it out, plant-based cleanse right before 4th of July. So I think we're going to go, June 21st?
June 21st, we're starting. But guys, you can register now because we need to send you out your supplements. We need to send you out your protein powder. We need to send you out your stuff, your kit. So make sure that you get in quick. We're going to put the link in the chat for you and in Facebook. Get in and register if you want to join us.
Yeah, and you know what, Karen, that cleanse we do, this is the same thing we do in January. One of the most common things that I hear is, oh my God, I don't hurt every morning. Like, I'm out of pain. Like, and then our bad habits roll back in. But if we're going to bed with a glass of wine every night and we're producing that pain, we got to remember that or, a cocktail, whatever it may be, ice cream, bowl of ice cream, that pushing of pain is going to influence other actions down the road. And unfortunately, like, there's a link, even though that link is way, way far apart, they start to make this decision on the gallbladder out happen back here by having that ice cream at night. So if we just start to navigate all of these things, better off it gets. So the number one thing, hands down, is diet. And there are a couple herbs, and I utilize these a lot. I don't really like pain medications. And I'll tell you why. Like, I'm not going to tell you I haven't used them in the past. I've tried them. I experimented with them. Because I give up other functions, like they make me drowsy. So I didn't want to give up that. Or they upset my stomach and I didn't want to give up that. So that was the balancing act that wasn't working for me. So I wasn't willing to give up the function. So with that being said, there's some herbs that I use that are absolutely fantastic. I'll just list them real quickly here. There is an herb if you have nerve pain, and especially if you have nerve pain, it keeps you from sleeping, sciatic pain, numbness and tingling. There's an herb I use, Karen, called Nervogesic. It's absolutely awesome. It's got California poppy in it, cordialis in it, with Jamaica dogwood. These are all herbs that have been used literally for thousands of years. We always use these, especially cordialis in traditional Chinese medicine. Phenomenal in calming the body, swinging the pendulum. These combination of herbs are so brilliant because they know part of pain takes place up here. So when even if the pain causes that sympathetic dominance, then we get to swing that pendulum over and then help the body relax, and parasympathetic rest, digest, heal, recover, rebuild. So that one, Nervogesic, often you might take just before bed. You might take 2-3 times a day. And then when you don't need it, you don't have to take it. It's just when you're experiencing that pain. There's another fantastic one called Salagesic. Salagesic literally comes from willow bark. That's what aspirin was made after. So if you want the natural version of it that still has all of the synergistic compounds, the synergistic herbs and minerals that come with that nature has, and it doesn't bother your stomach, it's a phenomenal pain relief thing. And this, you know what it works really good for too? Women who get cramps.
Oh, okay. Yeah.
It works really good for that. And there's also something called Crampplex that we have just randomly for cramping that has Salagesic in it. But just in terms of a general pain reliever, and you can use it in the same thing. You use it, put it back on your shelf. So there are really good things that can help facilitate the pain process in the body. Diet number one, herbs are always going to be more powerful than your vitamins. You know, and there's other things like glucosamine, and I use something called Ligaplex 2 for the joints. But those are repairing. But in terms of pain reduction, Nervogesic, Salagesic, absolutely phenomenal. And then also, which we've spoken a lot about in this show, turmeric. We use something called turmeric forte that becomes a facilitator of inflammation. And that just getting rid of, the reason the diet works so good, because you're reducing inflammation. Mm-hmm. When we reduce inflammation, you can get nutrients in the joints and out of the joints. You can get nutrients and vitamins in the tissues and out of the tissues so they can repair. So literally, whether you're bruising your body up, getting punched in the head or whatever, if you have the body down, if you'd use something like turmeric, and this could be long exercise, you can be on Peloton, just crushing it, producing a lot of inflammation. If you're doing that and you take your turmeric and you got your good diet, or you're taking a couple other vitamins or whole food vitamins or something, you heal faster. That's really the strategy that the threes are doing and the twos are about to do. Hopefully they stay in the game long enough and they start to use their pain for fuel. Another way of thinking of pain for fuel is deepen your strategy. You make that commitment. So like, I know deep down, like, I don't want to give up my martial arts. I don't know if it's the best thing for me, but I keep deepening my strategy. So, and I think I've talked about it. So there's a massage every Thursday. Usually, well, my pool's hot now, but I was dumping in my cold pool every night after that. So I do like cold and then hot and then warm, and then all these other things so I can keep doing that. But to deepen the strategy, but not just to crush myself, not to knucklehead this, but to let my body do everything it needs to keep up that process.
Yeah, and you could do that if running, like what you kind of were saying, maybe you love running, but it does hurt something. So maybe if you want to run, you also have to do yoga at least once a week or something, plus take your turmeric and make sure your diet's on point if you're going to run, because otherwise you get more injured. So I love that if you can have enough awareness, if you still got something that you love to do, because that actually, I mean, it might not be, improving your shoulder joints or whatever, but it does improve your mood, your mental health. There's other benefits, right, when you love an activity like that. So if you can be smart around the strategies, get some help, get some like ideas on how to minimize that impact, you can keep doing it.
Yeah. So, and it's real important that if we have that thing that we absolutely love, but it is really beating up our body, that we do the timeout before it's too late. There is an occasional too late. So I ended up having about a 7-year gap on my martial arts because my strategy was not keeping up with it. And so I literally was breaking my body down, and I hadn't figured out a strategy that I could keep going with. So it was a 7-year gap of my consistent training. And I gave up literally something that I loved, partially because I wasn't open to, I had to do all these things in order to do this. And this could be everything, anything, hun. This could be picking up your kids. Like, this could be playing basketball with your children. This could be going for a run, doing Peloton, dancing. It could be whatever it may be. As we get older, no doubt about it, we've got to deepen those strategies.
Yeah. No, I love that for sure. Awesome. So should we move on to, we're almost out of time here. Should we move on to our last question, or anything else you want to add on pain before we wrap up?
I think I hit it pretty good here. And I hope that everyone kind of takes it to heart and really sees, kind of where they fit into this. And again, we have influence on people who are in pain. You always have the ability to help someone move their journey, to help them become more pain tolerable, simply by saying the words, "You got this. You're a quick healer. You're a healing machine." The moment you say that to somebody, you've moved them into more pain tolerance. Pain thresholds are different. No one really has a good pain threshold. And it's all, it's all relative. It's all relative. I'll give you one more bad example. Like when I'm in the gym and we're boxing and we're sparring, it doesn't hurt when you get hit. I know that sounds crazy, but if someone just walks up to me in the street and punches me in the face, somehow like it's totally, it hurts, like, and you're scared and you're worried and all those things.
That happens to you? Because that doesn't happen to me.
No,
I get that analogy. I'm just,
So it's relative to how our approach is, and so much lies in our mindset. And that is also why when someone says to me, "Doc, do you think I can heal real fast?" I always say yes. I do.
Yeah, belief has such a huge, and I mean, we could do a whole show on that and all that. I mean, all the stuff that's around placebos and how much belief affects healing. I mean, that stuff is crazy, and there's so much research on it. It's real. So yeah, the more you can believe, or have people around you help you believe that you can heal fast, you can get over this, you got this, all that stuff is way more powerful than we give it credit.
Yeah, way more powerful. All right, that's really what my dad. So yeah, let's dive into our last question.
Our last question. So what is one action, and we've gone through a lot of actions, but what is one action our listeners can take from this show, put in practice right away to move them towards their goal of becoming superhuman?
That action, and this time I was a little prepared for this, and it is to get our brain in this mindset to always ask this simple question: is what is my body asking me for? It'll never lie to you. It'll never, when you say that, your body will never say, "Oh, I need more Doritos." It'll never say, "I need pain medication." It'll never say, "I need a gallbladder surgery." Never.
No. Yeah.
The answer, know how to interpret it, but the more frequently you ask it, the different types of answers will come up, and it literally can be a life changer.
Yeah, we can ask that for so many things. Like I always think it's a powerful one to ask for cravings. If I'm craving sugar, nine times out of 10, what my body's asking for is sleep. It's like the one time I massively crave sugar is when I'm having hitting it too hard, really just need to like have a nap. And so if the cravings for anything you're feeling, really being able to ask your body what it needs is awesome. Well, thanks so much, everybody. If you are interested in our cleanse, don't forget to register, jump in. We're going to do, Dr. Bart's going to do his Monday night live calls with everybody through it as well. So it's going to be super fun. And otherwise, we're going to be back here same time next week for another episode of the Health Made Simple show.
Yes. So just a quick reminder there. Yes, we're going to go live. We're going to go all in for 10 days. I'm looking forward to it. So it's a whole food diet. It's anything from just like cleaning yourself up a little better on the day, or getting rid of a little pain, or just getting yourself dialed back in, especially knowing the 4th of July is coming. So we designed it right before then. So real simple, but do take action quicker so you can get all your stuff. And I know some of these people already signed up to do it, which is awesome. So as usual, everyone for being here. Keep doing the thing, keep sharing out, keep spreading the love. We never know, like one of these little talks like that, how it really can influence someone else's life. So keep doing the thing. And as usual, we're going to take deliberate action for our minds, our body, overall wellness, and y'all be awesome.